Hello, my name is Nurse Engee. Today's topic is chronic venous insufficiency. We're going to be looking at the pathophysiology of chronic venous insufficiency. Chronic venous insufficiency, or CVI, occurs when incompetent venous valve allow blood to backflow. This retrograde blood flow creates a high pressure in vein, which can cause varicose veins, swelling, and eventually ulceration of the skin. Valves within veins generally allow for one-way flow, but as you can see at the image here, with chronic venous insufficiency, the valve becomes incompetent and allows for blood to flow backwards. This blood then pools in the leg. The risk factor for CVI are going to be anything that increases the venous pressure in the legs. This includes prolonged standing as well as history of deep venous thrombosis and obesity. All of these create extra pressure on the legs, which force blood down towards the bottom of the leg and don't allow it to come back up. When clients stand for a long period of time, blood does not have a chance to move and flow. It's going to become stagnant and venous stasis can occur. We also know that venous stasis often causes deep vein thrombosis. So it only makes sense that if clients have had a deep venous thrombosis before, they are at risk for another risk of CVI. Lastly, additional adipose tissue in the body is going to compress our veins and prevent the venous returns that we need to keep blood flowing. Now we're going to look at the assessment findings. Clients with CVI often have dependent edema. As the blood pools in the extremity, when the blood pools, it forces fluids and red blood cells into the surrounding tissues. As these red blood cells break down, hemosiderin is released, causing a reddish-brown skin discoloration. Over time, tissues are going to be replaced with one that is thick and often glittering. So as we can see in our image here, these clients have all these three things. They have edema, they have red skin discoloration, and they have skin that is becoming thickened and glittering. We are looking at the complications. The primary complication of CVI is venous stasis ulcer. These are often going to be located above the medial malleus and are going to be painful when the client is in an independent position. Pressure is going to increase as we get lower down the leg and especially going to be closer near the bony prominences. So the medial malleus checks both boxes and is often where this ulcer occurs. So we can see in the image to the left, the ulcer is going to be irregularly shaped and is going to be shallow. Here, it is located near the medial malleus and the skin around it is scaly and reddened. Unfortunately, a big complication of this ulcer is going to be a secondary infection. If we have open skin, we have an opportunity for bacteria to enter the body. Clients with secondary infection may present with systemic symptoms like fever and chills or leukocytosis. They may also present with localized symptoms so that area of ulceration may become increasingly reddened and the client may have increased pain. As shown in the image to the left, this client is having a lot of swelling and is causing the skin to starting to fall off. They also have a lot of reddened tissue and they are probably in a lot of pain because of the pressure on the lower leg. Here, what are the teachings for clients with CVI? When it comes to teaching a client with CVI, one of the biggest things we need to teach them is to avoid prolonged sitting or standing. Like mentioned earlier, prolonged standing is a big cause of CVI. If clients are in one position for too long, they are going to have pooling of the blood and they are going to be at risk for worsening CVI. Clients should also be taught to elevate their legs for a period of about 20 to 30 minutes in a period of time. Like previously said, we don't want them to have their legs up all the time and we don't want them to have their legs down all the time. But movement can help promote the blood flow. Clients need to wear compression stockings like the one seen in the image here. Compression stockings apply graduated pressure that is much stronger at the ankles and become less as you move up the calf. This graduated compression promotes venous return to the heart. A healthy weight should also be promoted for clients. Consuming adequate nutrients is going to help heal any ulcer, and having regular exercise is going to promote venous return. Like previously mentioned, obesity is a risk factor for chronic venous insufficiency because of increased adipose tissue in the legs. If we can decrease the amount of adipose tissue, we are going to decrease the risk for worsening CVI. We want clients to wear graduated compression stockings, but they need to avoid restrictive clothing, especially tight pants. If the pants are tight around the leg, they are not going to have the same effect as the graduated compression socks. They're just going to squeeze the legs and apply more pressure, and the blood is not going anywhere. Finally, along with a healthy diet, we want clients to walk daily. Gentle walking is going to help promote blood flow and keep clients feeling better. If clients cannot walk or unable to do so independently, we want to encourage activities that will still promote blood flow, such as things like foot pumping or ankle circles that can help to achieve the same results. And let's look at the nursing intervention. If clients with CVI developed ulcer, the most important nursing intervention are going to be those that will promote wound healing. We want to promote a diet with adequate proteins, calories, and nutrients. Clients cannot heal wounds if they don't have the nutrients to do so within their body. Additionally, if clients are diabetic, we need to help them control their blood glucose level. Remember that increased blood glucose level is going to delay wound healing. Regular wound care is also very important to help this ulcer to heal. Any necrotic or dead tissues need to be properly removed, and the wounds need to be cleansed with normal saline. It's important not to use iodine or hydrogen peroxide, as this can be damaging to healthy tissues. Dressing changes should be completed regularly, and we want our dressing to be moist but not overly saturated. If the dressing is too saturated, it's going to promote bacterial growth. But if it's undersaturated, it's going to stick to the ulcer and cause more pain for the clients. Ultimately, we want to catch any drainage that is coming from the ulcer and prevent it from getting elsewhere in the body. Importantly, for these ulcers, we are not going to give any antibiotics unless the client is showing signs of infection. We don't want to create an issue with resistance and give unnecessary medication. Finally, as a nurse, you need to monitor clients with CVI and ulcerations for signs of infection. If the edge of the wound is starting to grow or become more reddened, or if the client is experiencing pain or warmth, or if the color is changing, or if the odor of the discharge is changing, we need to alert the healthcare provider because the client may be experiencing an infection and we need to treat it quickly. Thank you for listening today. See you next time. Bye.